Good evening. My name is Irish Culverson, and I've given out handouts that give information on what sickle cell anemia is and what the actual disease is. It will show you a picture of what a normal blood cell looks like and what a sickled cell looks like. Increasing sickle cell awareness by informing individuals about the causes, the risk factors, signs, and symptoms is the first step in actually understanding what sickle cell anemia is. Did you know that sickle cell disease is the most common inherited blood disorder in the United States? Approximately 80,000 African Americans have this disease. About 1 in 12 African Americans and about 1 in 100 Hispanic Americans carry the sickle cell trait, which means they are carriers of the disease. Most children are born with symptoms ranging around 4 months old. Symptoms of sickle cell disease vary, and some people are mild, and in others it's very severe, which require hospitalization. The most common signs or symptoms that are linked to sickle cell is anemia. Anemia is a condition in which blood has a lower than normal amount of red blood cells. People with anemia do not have enough red blood cells to actually deliver oxygen to their organs, such as their brain, their heart, their lungs, or their spleen. So with that being said, they're going to, feel tired, weak, fatigue, which is one of the most common symptoms of sickle cell anemia. Many people with sickle cell disease live in chronic pain daily, especially in their bones. However, sudden pain that can occur anywhere in the body is the most common symptom that sickle cell disease displays within people with the disease. This is actually called a pain crisis. Sickle cell crisis often it starts in their bones, and then it continues and trickles down to other parts of their body. What people do not understand is that sickle cell is something that is inherited. You either get it a trait, abnormal trait from your mother, gene from your mother, or your father. You cannot have sickle cell with just one trait. People who inherit the sickle cell hemoglobin gene from one parent and a normal gene, they usually just have the trait, which I'm a carrier. People who have sickle cell trait can pass the hemoglobin gene over to their children, and the chances of inheriting 2 normal genes, a 50% chance of inheriting 1 normal gene and abnormal gene, is about a 25% chance. Who's at risk? People that have the trait, people that come from African descent or Hispanic Americans, people whose families are from the Mediterranean countries such as Turkey, Greece, Italy, Panamania, Caribbean islands. More than 2 million Americans have a sickle cell trait and don't even know it. The signs and symptoms of sickle cell, as I was telling you earlier, they vary. The most common signs, as I stated, is just anemia and pain, just being weak and in constant pain. Other signs and symptoms go from the disease complications, such as acute pain in their chest, spleen. They also have issues with concentration, which is a direct effect of things going on in their brain. So, with that being said, sickle cell research is extremely important, that we get out here to help improve others' lives that are suffering from the disease. I've discussed the causes, the symptoms, and some of the risk factors that people suffer with that have this disease. Again, just remember, the research will help a patient that is suffering from this disease. Thank you.